Hello everyone. Today my lecture is on bone grafts. Hello everyone. Today my lecture is on bone grafts. Bone graft, tissue or material used to repair a defect or deficiency is called as bone graft. It adds bulk or volume to the existing bone to solve a diagnosed problem. Bone grafting, surgical procedure that replaces the missing bone with material from patient's own body. An artificial, synthetic or natural bone substitute is, is known as bone graft. Types of bone graft based on the nature of the bone. It may be cancellous, cortical or corticocancellous. It based on the source, autogenous bone graft, allogenic or allograft or homograft. It may be isogenic or genograft or alloplast. Based on the vascularity, it may be non-vascularized or vascularized. Vascular flap bone graft may be pedicled or microvascular free transfer bone graft. Based on the donor site, the iliac crest from anterior and posterior ilium or trifine grafts, rib full thickness graft or split thickness graft, calvarian full thickness or split fibula graft, etc. Based on the function, it may be inlay graft, onlay graft, or reconstruction graft. Uses of bone grafts. Bone grafts are used to cover the congenital defects, trauma-related surgery, orthognathic procedures, or tumor surgeries. Principles of bone grafting. Um, it includes the harvest from the familiar site, avoid the contamination of the site, contour the graft to fit into the defect, absolute immobilization of the graft should be done, ensure the adequate blood supply to the graft material, don't have graft exposed, it should be covered properly, assess the graft take periodically. Biology of bone grafting. Osteogenesis. It involves the new bone formation by surviving creep osteoblast within the graft. Healing by mechanism, it is seen in vascularized bone graft and to some extent in cancellous bone grafts due to the rapid revascularization. Osteoinduction. It involves transformation of the local mesenchymal cells into the bone forming cells in the presence of an appropriate inductive stimulus. Insoluble polypeptide moieties and a specific enzyme known as bone morphogenic proteins regulated demineralization of bone prior to implantation is required for osteoinduction to occur. Osteoconduction. It is a prolonged procedure. Here, the bone graft functions as a non-viable scaffold for the gradual ingrowth of the blood vessels and osteoprogenitor cells from the recipient site with gradual resorption and deposition of new bone. This is called creeping substitution. It is predominantly seen in the cortical grafts. Healing of vascularized bone grafts. Superior healing and biochemical properties. Healing primarily by osteogenesis. No initial necrosis and don't require the revascularization. Based on the endosteal or periosteal blood supplies, similar healing may occur. Macrovascular anastomosis and rigid fixation promotes the primary healing. Heal with similar rates of bone formation when transferred to the non-irradiated or radiated beds. Autogenous bone grafting. Autologous or autogenous bone grafting involves the utilization bone obtaining from the same individual receiving the graft. The autogenous bone graft. The autogenous bone grafting involves the utilization of the bone obtained from the same individual receiving the graft. The autogenous bone grafts may be non-vascularized or vascularized. It can be particular cancellous bone marrow cortical blocks or a combination of the cortico-cancellar blocks. Non-vascularized autogenous bone grafts are harvested from the ilium, rib, calvarium, or other areas such as mandible, radius, and fibula, etc. Iliac crest bone graft figures are shown. The most preferred and versatile graft for the maxillofacial reconstruction. A good rule of thumb: 10 cc uncompressed cancellous bone required for 1 cm of the defect. It has the greatest absolute cancellous bone volume. Anterior ilium contains 50 cc and posterior ilium 100 cc. Rib grafts. Sources: 4th to 8th ribs. In the figure, the ribs are shown. Upper ribs greater size and width and suitable for mandibular reconstruction. The lower ribs, which are rounded, suitable for condylar replacement, nasal deformities, etc. Allografts. They are the frozen bone grafts, freeze dried bone grafts, and demineralized freeze dried bone allograft. Bone morphogenic proteins. Bone formed by induction at the ectopic sites, according to risk. BMPs, group of growth factors and cytokines known for their ability to induce the formation of bone and cartilage. Originally, 7 such proteins were discovered, BMP2 to BMP7. Since then, 13 more BMPs have been discovered, and today's is total to 20. Alloplast, such as methacrylate, silicone, polyethylene implants, uh, polyester fluoroethylene. It is also known as proplast. The use of alloplast have been associated with infection, foreign body reaction, and resorption of the bone at the recipient site. Bone graft substitute: calcium phosphate, calcium sulfate, collagen-based matrices, demineralized bone graft matrix, and hydroxyapatite, tricalcium phosphate, or osteoinductive proteins. Alloplasts may also be synthetic materials such as acrylates, silicones, polyethylene implants. Advantages are no donor site morbidity, reduced operating time, and provide the more material. And disadvantages include the foreign body reactions and resorption of the bone at the recipient sites. Thank you.